Hello.
Welcome back to another video.
Pick a topic, pick a topic. Let's see what this says. I think I can't get another one. Okay. Alright, so what are your thoughts on healthcare in Canada versus Barbados?
Okay, you start because you're the nurse.
Um, what I would say is healthcare is universal when it comes to having it free here in this country and back home. The only difference is they up here has like a health card, but back home we just say yeah we ain't feeling good and we go on E&E and that's it. They just need our information and that's it. It's free. As citizens or as people with work permit or whatever. What I would say though is that healthcare in Canada, um, you have the same wait times. I think this is worldwide. You're gonna have issues with waiting times. You're gonna have issues dealing with nurses, doctors who might not be having a good day or whatever. Um, you might the only what I would say is the only difference is we have like Canada has better equipment. You can diagnose quicker or whatever compared to the Caribbean because yes we have stuff to diagnose but then it's like the money sky high, you know. Um, what more can I say? Should you help me because you
Okay,
were
so
so that's something.
what I would say is that, because I'm going to keep it 100% real. Sorry, days. Man. The cold.
The cold.
Anyway.
Don't worry, it's flu season, so it's okay.
Right, so anyway, Canada's Canada's issue, in my opinion, with healthcare would be the wait times. However, um, what I would say is that I don't think Canada is as bad as back home, from what I heard, because okay, so wait time for Canada when you go to the hospital maybe about 6 to 8 hours. You may be waiting, which Canadians find very ridiculous,
Yeah.
including myself, right? And as you know, I went through a season of illness, and I had to be in the hospital a lot, and so I know personally what it was like. At times, it was very frustrating. However, I've heard stories home where people have been waiting like 24 hours. So I don't know, like complaining about an 8 hour wait and then you have over here a 24-hour wait. That's like ridiculous. That's number one. In terms of Canada's healthcare, um, well, I don't want to say Canada. I'll say Ontario. Ontario covers you with OHIP, which is the Ontario Health Insurance Plan, and all Ontario residents have that have access to OHIP, and with that you are covered. As long as it is medical care, you are covered in terms of hospital visit, doctor visits, CT scans, MRIs, ultrasounds, surgeries, anything like that. You name it, you're covered. You don't have to pay out of pocket for anything. There's certain things you pay out of pocket. Some blood work tests you may pay out of pocket for, but the majority of blood work tests you don't. Is also covered. Back home, I believe is certain things are also covered as well, but the problem comes with the wait time home. Also, when it comes to surgeries and things like that, people would rather go to private care in Barbados. When I say home, I mean Barbados too. People will go to private care because the wait time is ridiculous. Sometimes I hear people say they have to wait like 6, 7, 8 months to get a procedure done. To be honest, in Canada it's the same thing. People wait a very lengthy time to get a procedure done as well. And so when you really need a procedure done, you may want to pay for it out of pocket. Also, first, like I said, ultrasound, CT scans, and MRIs in Barbados, most of the time people go pay for it out of pocket, and it's very pricey because first of all, you don't have the equipment.
Right.
You might have like one or two MRI machines home or something in the hospital. I don't know the number, but where you have a large number of people waiting for an MRI scan or a CT scan, and you don't have the machines to do what you have to do, then people are gonna pay if they can pay, and if they can't pay, they have no choice but to wait. And sometimes this wait can be years. So it's very unfortunate, but hopefully it's something that can be worked time.
But I just want to cut in here because you talking about having MRIs here or whatever and the wait time. I don't even think the hospital right now as we speak in Barbados has an MRI machine. They send out people to go to the private entities to go and get their MRI. Yes, you could get a CT scan at the hospital. But every person who needs to get an MRI has to do private, right? The different diagnostic places that you have to do, right? But as Shanita said, the wait time is so ridiculous that you gotta pay even for. Sometimes you might gotta go for like, let's say for example, a blood test to figure out if you have an illness called gastritis. You might gotta go now to the a different lab back home and say, oh, I gotta get my blood test due $200 and somebody dollars just for a blood test, right?
And I find it kind of weird too because, like, for example, my dad just went through a situation and he had to get a CT scan done, which cost him a certain amount of money. And then what made me like freak out in my head was that he said to get the contrast was an additional
$200.
Yeah.
Yeah.
And for me, it was really like mind blowing because in my mind, I was like, well, I just had like a million CT scans, a million MRIs, a million. When I say a million, I'm exaggerating, but I'm just saying I had so much because of the condition I had and the very huge surgery that I had. And I had to get a lot of CT scans, a lot of MRIs and stuff like that just to like see, so they can see what they have to work on. And I had to get contrast a few times as well. And I didn't have to pay for any of this. And for me personally, with my situation, because it was pretty serious and everything else, but my condition is a condition that many women all over the world, millions of women suffer with, which is endometriosis. But I had a rare form, and it was very serious and so on. So I didn't really have much of a wait time.
Right.
I mean, before that, I waited a long time, trying to get diagnosed and all these different things. But once things really started getting crazy, then everything kind of happened quickly, like back to back. And to think that I would have to pay that amount of money, I don't know what I would do because it's just so expensive.
Yeah.
So
you probably would have had to pay up to about $10,000 to $15,000 just for those diagnostic.
And that has
tests.
nothing to do with the surgery itself.
Correct.
So which my surgery was, we will discuss the endometriosis another video, but my surgery was 10.5 hours long.
Yeah.
So you will understand. So basically, like, I mean, when it comes to wait times, ridiculous, when it comes to having to pay, ridiculous. Then I also have to talk about the customer service.
Yeah.
Customer service in Canada, yes, there might be one or two people that might want to have a little attitude and treat you whatever, but in my experience, dealing with nurses, the doctors, and the medical care personnel, I had great experience. They recognized they were dealing with somebody with a situation, and it was a vulnerable time, and they were very patient, very kind. They answered all the questions. I was also fortunate enough to have my mom and my sister, and my dad as well, who came afterwards. But my sister and my mom was there for a large majority of the time, and they were able to ask questions on my behalf. They asked about the medications they were giving me, which I was just say here is a very, very important thing to do. Whatever you're getting the procedure done, make sure you know what they're giving you in terms of medication.
And this is for worldwide as well.
Worldwide.
Worldwide.
Because you want to make sure you know what your is going into your body, right? And ask all the important questions, and they were there to do that. And then they have to say also that during my entire time in the hospital, from the start to the finish, from going into the hospital directly during the surgery, after surgery, post-operative care, everything, they were with me throughout the entire time, and they were there in my hospital room. I had my sister coming in and out of the hospital room constantly, and my mom stayed the entire time. My mom did not leave my side at all. At all. She was just there the entire time.
Don't get emotional now.
And and my dad also came and he was there, and at one point my mom and my dad was there sleeping in the hospital room. And I don't know that's
that
something
is,
that will happen
let me tell you
in
now,
Barbados.
that is not. In Barbados, let me tell you, their visiting hours. Visiting hours is 4 to 8 and 12 to 1. Not a man just sleeping on them wards thereafter.
And the joke is
Only, sorry, one second. Only for pediatric patients.
right, right.
That one, not two. One parent must be at the bedside at all times, if anything or whatever.
And the joke about it is, they were like, "Oh, do you guys want like a pillow? Like, do you guys want this? Do you like they like?" I had to ask for blanket. Obviously, they're not gonna come and like take your, because they're not the patient, right? But they still try to make sure my mother, and then obviously my father came afterwards, and so they tried to make sure that they were very comfortable as well. Nurses were pretty impressed too, because my mom was just there right through, and some of them were like, "I haven't seen nothing like this," you know. So, but yeah, that's another thing. Like, when in Barbados you have visiting hours, but you don't have the person literally there right through. And I think that support for me, I think that helped with my recovery in the hospital. A big like that was a big deal for me, because having looking over after having that surgery, looking over and seeing my mother there, was very, very like, I don't know, just super encouraging for me. Super encouraging.
Well, let me
So,
just say, right? I thank God that Shanita was not in Barbados doing this surgery. I am telling you, I used to work at the hospital when I was a student. I can safely say that couldn't work. They would tell my lady, it's time to
to
go.
go. Yeah, so that's one of the things. And I honestly think that home in Barbados, I love my country very much, but I think we need to really rethink the strategies when it comes to healthcare, and when it comes to, because healthcare is a very vulnerable time in a person's life. I can't help but say that. And you need the support.
Yeah.
You know what I mean? And the nurses are running from this patient to this patient to this patient to this patient. You can't have individualistic care. And individualistic care can help a person recover much faster than you going from here to here to here to here. And then half the time you can't really get what you need, because unfortunately they're all over the place, which they have to be, because that's their job, right? And you have to understand where the nurses are coming from as well. So,
What I would say, just to add, is that I think because we don't have a lot of nurses are burnt out. And then to, like, yes, we are caring for patients, but it is so difficult to literally see the needs of the patient. The thing for us versus college, college taught us we have to look at the patient holistically. We have to look at the family, we gotta look at social, we gotta look at psychosocial, all of those things. When we get into the clinical setting, it is more so of keeping the patient alive. That's it. You can't worry about um how about the family, the feelings, like what's the word, like
emotional
emotional
aspect.
aspect. Like, for example, Maslow hierarchy of needs. We just look at need one and need two, which is physiological and safety. We don't always go up to three, four, and five, and those are things that can help patients get better. But because our thing is keep them alive, and we have it might be one of us to about 4 or 5 patients, and you gotta be running rings just like this. So you can't really understand what the patient is feeling because you studying about this patient, the next patient, the third patient. So I'm giving the nurses aspect versus the patient aspect. And I'm not saying that we can't look at it, but it's always a case of we always have to be going because we have to make sure everybody stays alive and well, and you know our goal is to get them out, get the patients out so that they can live their normal life in the community.
Right. And I understand all of that, which is why it would be such a better idea
Right.
to have at least even if it's one, to have one family member
Member.
stay with the patient, because then they can give that the individual attention they might need.
Right.
The emotional aspect where the nurses can't really focus on them that much. But I know, of course, there are times too where family members are busy and doing different things too, and they can't really stay.
Right.
My case was a different situation. In Canada, the same way, in the room, there were people that weren't there, fam- patients that they didn't really have their family, because the reality is people get busy and they have their lives to deal with, and so they have to work, so on and so forth, right? But I think it's very important, even in a situation like this. I think it's very important, though, to be kind,
Right.
to be compassionate, to be understanding. Because the last thing that a patient needs is for you to be rude,
Right.
and unmannerly, and treating them with disrespect or whatever, just because you're having a bad day.
Right.
Because you're having a bad day and they're dealing with a chronic condition, they're dealing with an illness, they're dealing with a disease, they're dealing with whatever, which is infecting their body. So your bad day can't get worse than the patient's bad day. Think about it that way, right? Because they're actually dealing with a situation. So nothing is wrong with a smile. Nothing is wrong with saying good morning, how are you doing, checking out on your patient, talking. I understand you have to be running from place to place, but when you are dealing with the patient, be kind, be nice, be compassionate. So and I felt in Canada I got that for the most part. I'm not saying everybody is like that, because they're not. Because I have had situations where I dealt with a few rude people, not very many, because I myself kind of would get very, aggravated, and they would say it was on my mind. But for the most part, I had awesome nurses and awesome hospital personnel and medical care people as well.
What I would say too about home, there are some nurses who are phenomenal. Customer service is phenomenal. When I was working as a student, even even me, I'll speak about myself too. I would have had patients come to me, so nurse, who you? I'd be like, I good, who you? Then they say, you remember me? I don't put so and so. I'd be like, oh, I can't tell you who the body is, right? I can't see who the body is, but it shows that there it was. I treated them with the respect that they wanted.
Yeah.
I made sure I was there for them. Even yes, as a student, it was a bit difficult because you got to be running here, there, and yonder too. But the something as simple as Shinta said, a simple good morning, a simple how are you doing, a simple smile, a simple hug will make that patient's day. Because especially like back home when you don't have family members, really nurses have to be their family members.
Yeah.
Now we have to be there for them. So even though we might be talking about, or some people, I should say, people talk about, oh, the nurses in Barbados are real bad. You have actually more nurses that are good versus who are bad. And I can testify to it because I have worked with some of them. I've seen how they dealt with the patients. They tell them jokes, they make them laugh, and you will be surprised. Blood pressures went down, heart rates went down, um, blood pressures went up, maybe dehydration, whatever. But the point is, saying something nice to somebody, and this doesn't even have to do with healthcare. No, this is
Across the board.
across the board. There we go. Across the board, saying something nice to somebody, making somebody laugh, Saying good morning would carry that person's day a whole lot better and stuff like that.
But when it comes down now to just healthcare in Barbados versus healthcare in Canada, which I can't really say much about Barbados, just except for what I've heard. Um, I think both countries can definitely have, improve. There's always room for improvement. I think Canada has a really good customer service. Of course, Canada is a big country. Is that you're comparing apples and oranges because Canada is huge and Barbados is small, but
Yeah.
Still customer service is universal.
Yeah.
Like it makes the difference. It can help people get better. In terms of wait times, yes, both countries have the same thing, but I think Barbados obviously again a bit over the top.
A little over the top.
Yeah.
Yeah.
But I don't know. I think that there's always room for improvement, and my hope for both countries is that they continue to work because the goal is to make your patients better. So that's what I have to say about that question.
I agree. All right, guys.
Bye. Subscribe.
She don't know how to say it, so let me say it. Please like,
share,
and subscribe. Bye bye.